Assalamualaikum and good evening. My name is Nur Hayati binti Ismail. I want to teach you about spinal motion restriction in pre-hospital care. Okay, first, restriction pre-hospital procedure. Also, student will identify at least two mechanisms of injury that are associated with potential spinal cord injury. Student will identify at least two subsets of patients at higher risk for spinal injury. Student will list symptoms of spinal cord lesion. You will be able to justify the need for spinal motion restriction based on patient risk factor. An assessment signs and system consistent with possible spinal cord injury. Okay. Spinal motion restriction. This provide spinal care is for provide spinal care when indicated. Do not administer interventions when unnecessary. Do not use SMR if not necessary. Okay. Clinical criteria have been proven to identify patients at extremely low risk for unstable spinal injury. Okay, the goal of SMR. SMR is spinal motion restriction. Okay, to maintain neutral alignment of the spine during transport of the patient responsible for spinal injury. It's also to reduce excessive movement of the spine that may worsen existing spinal trauma and neurologic deficit. Okay. Criteria of clearance SMR through NICS's criteria is clearance protocol consistent of 5 criteria. NSAID this is for clearance protocol. Clearance NSAID is N for neurology deficit. S is spinal tenderness. A for altered mental status. I is intoxication. D is distracting pain. Okay. This is anatomy of human spine. This has a cervical nerves for C1 to C8. Another for thoracic nerve T1 to T12. Okay. For lumbar nerve L1 to L5. For sacral nerve S1 to S5. This juga this anatomy and physiology for sacral. Okay. Spinal immobilization involves the use of a number of devices and strategies to stabilize the spinal column after injury and thus prevent spinal cord damage. The practice is widely recommended and widely used in trauma patients with suspected spinal cord injury in the pre-hospital setting. There is in the pre-hospital setting, not in hospital, but in the example in the trauma place like accident place. So before you transport, you need to SMR or not for the patient. You need to identify first. Okay. Indication for SMR: midline spinal pain or tenderness. You need to examine their midline spinal. That's a pain or tenderness. You need to use SMR. Okay, altered mental status GCS. If GCS full, you need to look at the first the spinal tenderness. If no and GCS full, no need to use SMR. Paralysis or neurology sign. Example, the patient get numbness that the area of the injury. Yes, you need to do SMR. Inability to communicate. Patient is as drop lah. Cannot respond to you, so you see the tenderness and you need to SMR first. Okay, sign and symptom of spinal cord injury is pain, tenderness, painful movement, deformity, paralysis, paralysis, shock, hypotension, bradycardia, or decreased cardiac output. Increased cardiac output lah. Prepism. For equipment, what you need to bring when you do SMR. First, you need cervical collar, head immobilization. This is an example lah. For cervical collar, head immobilization, spinal board, scope stretcher, bucket stretcher, spider strap, KED, or stand for Kendrick extraction device, and vacuum mattress. This is a cervical collar. Okay, this cervical collar the purpose of cervical collar is to support your neck and spinal cord and to limit the movement of your neck and head. Okay, this cervical collar. This is called head immobilization. Head immobilization is a device designed for head immobilization on the case where spinal injury is suspected. This is more stable lah. The patient cannot move at all. Okay. For the spinal board is a patient handling device used primarily in pre-hospital trauma care. It is designed to provide rigid support during movement of a person with suspected spinal or limb injury. This for transfer patient. Patient cannot move, you need to use spinal board. Okay. These are the one spinal board with head immobilization. Okay, this is scope stretcher. The scope stretcher is a device used specifically for moving injured people. It's an ideal for carrying casualty with possible spinal injury. These are more for a spinal injury. Yeah? You can strap the patient with the bell. Allow you to scoop the patient off the floor without having to roll them and carry them to whether your cord may be located. Okay, this is more this scope stretcher. You no need to move the patient for right to side lah, because this can open. So you can open the stretcher, divide by 2. So you need to right side and left side, you combine and you strap lah. You can move up the patient. No need to push the patient right to left side. Okay, this bucket stretcher. Bucket stretcher is designed for use in the most rugged of environments such as mountain, sea and air. It's durable, non-toxic, anti-corrosive and or chemical with fire resistant. This bucket stretcher is more to patient with mounting, go for climb, so need to put them to hospital. You need to use bucket stretcher. It's more stabilized lah. Not patient cannot move. Okay. This is the example. Another bucket. This user. Okay, this spider strap. The spider strap is an innovative strapping system for securing patient to the full backboard of scope stretcher. It is easy to use, efficient and will rapidly become an essential piece of equipment. Okay, this is same lah with others, but it's the spider strap. Need use for together with scope stretcher, so you can tie the patient lah more safely. Okay, the spider strap is quickly applied and holds the patient securely and comfortable to the backboard. More comfortable. Okay, for this strap. Okay, KED. Extension for Kendrick Extraction Device. This is a device that used in a vehicle extraction to remove victim to traffic collisions from motor vehicle. Commonly carried on ambulance, the KED is typically applied by emergency medical technician, paramedic or another first responder. This is a KED used in patient driving car, lorry, when get accident. How you want to put the patient from car to the stretcher? You need to use this KED in position, sitting position. Sitting position in the driver. You need put it KED in the back before you put the patient up from the car. Okay. Like this, you need to use this first. You need to wear the KED first, wear the cervical collar first. Then after you complete, then you can move the patient out. Okay. The rapid extraction technique is designed to move a patient in a series of coordinate movement from the sitting position to supine position. From sitting to supine, you don't know the injury is in the spinal cord or another. So you need to secure first with KED. Okay. Supine and along while always maintaining stabilization and support for the head or neck, toes and pelvis. Yeah. Okay, this is vacuum mattress. A vacuum mattress or vac mat is a medical device used for immobilization of patient, especially in case of vertebra, pelvis or limb trauma, especially for femur trauma. It is also used for manual transportation of patient for short distance. It replaces the stretcher. This is a vacuum mattress. We use not used for hard cover like others. This vacuum mattress is more soft, like puffable lah. Okay, like this we use, and we carry the patient with the tie. Okay, with the tie. Okay, thank you. Any question?
No.
Okay, do you understand what I talking about for this procedure for SMR? Okay, yeah?
Clear.
I got a question. First, this situation, 28 years old, male found not responsive. Need SMR or not?
Yes, SMR.
Why?
No of injury.
Don't know? Mechanical of injury. Right. Okay, for 45, another question is 45 years old, complain of chronic back pain. Need SMR or not?
No.
Not because
Don't have a chronic
mechanism
injury.
Mechanism injury. Okay. This is the answer lah. No need you to know MOI lah. And okay. Okay. Thank you.